Welcome to On the Record and welcome to Dr. Mikel Hoff. We're here in Marbella. Mikel, welcome to you, and you're speaking from your clinic, which is in Nueva Andalusia, which is part of Marbella. You've got lots of medical qualifications, but you are not happy, perhaps, with conventional medicine in that it did not touch the parts on occasion of the personal connection. Now, I can best explain that because a lot of people say the same thing to me, in that medicine has changed. You used to have a family doctor who knew you and your family intimately. And as a young child, you could get put on the knee of the doctor. He could make you feel comfortable and at home, and the relationship carried on for the rest of your life. Mikel, things have changed, but they've not changed for the better, have they?
No, I think that the medicine have changed a lot, because that was when I was a kid and you came to your doctor and you didn't feel good and he put you in the lab or talked to you and he took time. It was no stress and make sure you feel comfortable, and you really was not afraid to go to the doctor at all. It was actually, he's going to help you. This is totally lost today. And here in our medical education center here in Nueva Andalusia, ANF Academy, we're actually teaching to go back to this, to put patient in the center, take time. We don't have a clock that says it's going to take 10 minutes or 1 hour. We take time to explain why you have a problem and actually make the patients go back. And this is what we teach every single day here, which I think is basics and ethically how it should be. And I think I talk to many colleagues around the world, and they totally agree, but they are not in charge of the system. Of course, it's getting more and more people that it's getting sick and getting problems, and the resources in the hospital and stuff is maybe limited. So that's why they put the time pressure on. So all the people that work in hospitals and the official system is too stressed today, and therefore they have no time. And I believe everyone that chose this line of work choose it because we want to make a difference. We want to help people. We want to take care of them, and we want to use our heart and soul and mind to give them as good life as possible. But if the system and the resource doesn't allow us, it's very, very hard.
Well, we're talking about ANF, and this is very specialized treatment that you've discovered yourself. Mm-hmm. And we've had lots of recommendations about what you're doing in your clinic. Mm-hmm. Now, this is a delicate question, because what we tend to find on the Costa del Sol is that there are phenomenal medical facilities here, more than mm-hmm. anywhere else, perhaps in the world. But there's the bad and the good, Mikel. And you have to be very careful sometimes. It's mm-hmm. very easy to stick a certificate on a wall, but when you look at that certificate very closely, that doctor may have attended a course for 2 hours, maybe in Barcelona, and it's completely meaningless. Yeah. Now, that is not your position. In fact, you treat, I know, and your colleagues there, people directly, mm-hmm. But you also have a school of medicine, let's call it, for doctors who mm-hmm. want to complete, if you wish, their training. They can only get so far with a particular patient, and then the treatment seems to come to a stop. But you can improve the situation. Tell us how.
Yeah, I'm honored to tell you that. Yeah, of course, we have. First of all, I'm going to explain a little bit what ANF is and the medical device is. This is a medical device, and maybe I have it here, and it's a small circle device that is sharp with neurological frequencies. When I started 30, 40 years ago in normal medicine, we, of course, learned to treat symptoms, and we understand this, but I always was curious, where does all this come from? Who is controlling if you get sick or not? What is actually the pre-process of a disease? And we find out that it actually is the nerve system. The nerve system controls everything in our human body. We can today get a new heart, we can get new lungs, we can get new kidneys, we can get liver transplantation. We can more or less change everything. But if the nerve system goes down, we are finished. It's very, very simple. And what we find out, if we can have a device that can send in a correction frequency and repair the neural oscillation, we should not get sick. If we just eat normally, drink our water, and stay away from toxins, the body should be able to manage itself. So 13 years ago, we was lucky to find a very specific engineer that worked at the time with NASA, did for many, many years, and said that we have this material that can send, reflect, and storage a frequency. And I said to him, it's our partner these days. And I said to him, it's impossible because I know these have been tried to done for many years. And he said, have you ever thought about how we can send a drone to the moon or to Mars, and we can fly it around on the moon and Mars from Houston, Texas? And I said, no, not really. This is the material. Everything can travel through time and space. The only thing that can do that is frequencies. So we went over there to the research lab, and I tried the neurological frequency that I had, and we get it to work. And today we have a medical education center for medical professionals that have minimum 2 years of clinical experience. And they need to have, to join this education, they need to have a university degree, of course. And they get scans because, as you said, we are not interested here to have any students that come here and say, how much money can I earn on this, blah, blah, blah. We are interested in people. What can this do for my patients? And this is just another tool, together with everything else they have as a physiotherapist, osteopath, medical doctor, surgeon, to make their patients even better. Because what I know, this is the only thing that can remove chronic or acute inflammation or pain in very short time, and also give a long-term results. We actually published the first study for some months ago and now I don't remember the name, but it can probably be found in our homepage. But anyhow, and it's so amazing to have patients that come here. We have a slogan called "When nothing else helps." And most patients that we get from all over that comes here to Spain have tried everything, and they have big problems. And when they get better, to see that smile on their face, it's the best salary on this planet. So this is a medical school, or a school for medical and professional healthcare people. And we have 2 days per week we take patients here. All the other days we have education. We actually have a group here now from all over the world, and it's amazing. It's fantastic. Yeah.
Now, if we're talking about inflammation, that is responsible for everything from, well, cancer to rheumatism.
Yeah.
Now, we've actually this very day been handed a paper from the United States that clearly shows that 3 decades ago, 1 in 10 people could look forward, that's the wrong way of putting it, to getting cancer. Only 1 in 10 people got cancer. Now it's 50%.
Yeah.
What's going on, Michael?
No, this is a very interesting topic. When I started many years ago, and if I met the person that have cancer or whatever, or heard about it, I get shocked. Today, I'm shocked if they don't have it. It's several different reasons. First of all, you're 100% correct. Inflammation is the root cause of everything. We need to understand we have a lymphatic system that contains 15 liters of lymph liquid, and this lymph liquid, together with 600 lymphatic nodes, is creating our immune response. And in every lymph node, you have 4 different stages of immune response to explain easy. You have the first response, the normal B cells, then you have the T cells, and then you have the NK cells, and then you have the most important, let's call them B cells plus. That is our main antibodies. And they are controlling, together with the nerve system and the cardiovascular system, our immune response. Actually, the most important key here for the immune response is melatonin and our adrenal glands for all the biochemical immune response. They are also regulating a lot of braccanin and all this get creating the inflammatory state. So if you get exposed, even for extreme emotional trauma, or you have negative stress, or you get a virus, the first thing that happens is that the lymphatic system releases immune response 1. That means it creates inflammation, and this inflammation is increasing the blood circulation to try to move immune cells to the area and kill the threat that is going on in our body. But at the same time, we also get a high release of cortisol, stress hormone. And this stress hormone is actually to protect us. It says to all other immune response that, hey guys, take it easy. Now you cannot work as normally. We need to fix this problem first. What happens then is that in the liver, we produce something that's called glutathione. And this antioxidant contains more than 100,000 fragments from history in our body to kill so-called free radicals. This antioxidant exists everywhere in the body, but if something happens to you, it will move these resources, if the liver is good, to the actual area to destroy the free radicals that create mutations of cells. If that doesn't happen, and if your liver or anything of these are weak, this inflammation will be slowly chronic. But to develop cancer, it takes between 10 to 40 years until you can get the diagnosis. Because as long as your body have resources, it can fight against this mutation. But the older we get, we are actually destroying this resource. And one thing that really happens here is that we humans are quite stupid. Sorry to say this. When we feel bad, we go and buy a lot of supplements. Even worse, we eat more sugar when we not feel happy, or we're drinking alcohol, or we try to prevent these negative emotions because we don't understand. Our negative emotions is exactly controlled by the cortisol. So the more cortisol your body release, affect your emotional nerve system, the center you have in your stomach, that's also known as a second brain. The longer these cortisol release happenings, in the beginning protected, but it's just continue, you will feel worse. You start to develop now anxiety. You start to develop depression. You start to doubt yourself and get self-violated. Now it also starts to be pain a little bit everywhere in your body. And then 20, 30 years later, you go to the doctor and they say you probably have cancer. And I think that all of these could be prevented and stopped if the knowledge of the biochemical function of the body and the importance of the liver and the water, and this is why frequency medicine is so important, is we need to understand that we are living in a frequency field. We have the atmosphere that creating a very, very specific frequency. We have the gravity that create the negative frequency. In between, we have the human body that contains more than 60 to 80% water, but we don't drink water. And this water, we have a very specific frequency of 147.8 something terahertz. And these three frequencies make our body live. And this makes us exist. And one of them disappears, we are finished. And this is why I say to all the patients, the most important thing you can do is to drink water, 3 liters a day, but not bulking, to make sure that your level of water is strong and high enough so we can use the atmospheres and gravity.
Michael, not a lot of people can drink 3 liters of water a day. It's hard work to get 1.5 liters. I mean, do you have to force yourself to drink?
No, it's in the beginning, because we're not used to it, the body will reject it. But what people do wrong, it's the second way to actually know if you hydrate enough. Every time you go and urinate, if the urine is clear, your body is hydrated enough. But here in Spain, where it's so hot, you should actually recommend it to actually refill your water with 6 liters a day. Sounds a lot, yes, because people say, oh, what about my electrolytes and my kidneys? Don't worry, your immune system will take care. It's only if you drink too fast. If you drink 3 liters in 1 hour, of course, the body cannot take it. It's impossible. So we say to that a half a liter per hour and the 50 centiliters or a bottle like this, that is not much. If you then compare how much coffee we drink, tea we drink, other things, then it's nothing to drink 50 centiliters of water, because your health will definitely increase massively and the nerve system will work better and your immune system will work better. We need to understand here that the liver that have more than 500 specific biochemical functions is essential that we have a hydrated body, because the liver also for fertility, for brain function, it's a master key to everything. And this is my theory, that most of the severe neurological diseases is actually because of liver toxins. We need to remember that the liver need extremely high amount of HDL cortisol to keep our brain development. And if the liver, and that's only produced in the liver, only LDL, the negative cholesterol, or it's actually not negative either, because the LDL is used to create fusion between nitric oxide and cholesterol to create vasodilation in our vessels and veins. But the HDL is essential for our brain development and also to help the antioxidants that we have in our brain and the neurological functions, so the brain can live and work nicely. So you can see many times like brain fog or migraine is actually caused by low liver function. So we are treating here many people with migraine or brain fog, and we treat only the liver with anti-inflammatory devices, and boom, it's gone. And this is, I don't know if I take this too deep, but I'm really burning. It's always nice to have a person like you, Ronnie, that's interested in a different angle. And when we come back to cancer, we need to understand that as long as the body have resources, we cannot get it. We can call it genetic. Genetic it can be, because we need to also to understand, I say to a lot of people, it's just so amazing, we're going to have a baby. And I said, oh, it's so cute. And I said, have you ever thought about 1 second, how can your female body produce a baby? How can your body know where this baby's heart's going to be, where the liver going to be, where the intestine, and what they're going to do when they grow up? We take it for granted. But this is copy-paste from the mother's neurological system. So in the female body, the neurological function have, you can say, their own brain. It remembers from the mother's function to her, and then it's copy-paste for generation. If there is any kind of toxicity, neurological disorder, or anything of this neurolocalization that is missing during the pregnancy, then it will be missing of the next generation as well. And therefore it can become genetic, a lack of resources, because our neurological and biochemical function need to constantly be 100% to be able to teach the new body what cells does it need, how does it communicate, what resource. And this is how the antibodies and everything is coming from the mother's breast milk. And I say that to everyone. I get so frustrated when I hear young mothers say, I'm not going to breastfeed. And I said to them, you have not a clue what you're talking about, because the most highest fat whatsoever that the human body ever gets is the mother's breast milk. But this breast milk contains so many DNAs and RNAs and neurological storage and fat that creating the liver and develop the baby's brain, which is the ADL. And if that's not done properly, you can have a risk 10, 20 years later to develop cancer. Or if you're eating a lot of medications. or artificial supplements whatsoever. You can call it ecological, whatever. But we need to understand and think about how much can my liver take? Why do we get non-alcoholic fatty liver, etc., etc.? It's because of what we eat. And this is what we teach here to healthcare and medical professionals, to understand the biochemical neurological root cause of the problem, together with all the other medical knowledge you have, to have as many approaches as possible. So most thing they learn here is neurological and biochemical and clinical examination. We are not using any machines whatsoever. We have ultrasound and all this, but we never use. We teach people to feel and use their hands. So many people that come here and patients say, "My God, you are examining my body. I've been with my doctor for many, many years. He never touched me." And for me, it's like this, that if you don't touch the patient, how can you find out what's wrong? And I was taught like this, that you can feel anything with your hands if you know what to feel for. And this, I think, is very, very essential. And also to look at the patient, the skin, the eyes, all of these external things that will tell you a story, right?
Yeah, for many years, thinking about the liver, Michael, you have the situation, and maybe this is old-fashioned medicine, but it seems to be coming back. There's a product, a supplement called milk thistle, which is supposed to help the liver greatly. I mean, do you go along those lines?
No, not really. I have not so big experience of it, and because I'm looking into the more of the human resources that we have, and how the liver actually works and what resources the liver have, and because we need to understand that every organ have its the unique function, and then it have the second, that is collateral function. So every single organ in the human body, except for our intestines, have you could say 2 neurological frequencies. One is for the individual function, what they do every day in the different process. And the other one is the collaboration, where it's communicating with the rest of our system. And I think that what's important here, the point I will say with that is we need to understand the body is a unit. It's not just to go in, I'm the liver specialist, I'm the lung specialist, whatever. We need to understand all of these guys need to work together. And one of the most important things here, we talk about the liver, is also the lungs. The lungs is actually a major factor in everything that the human body does. And why do I say this? Yes, it's not only to fill the blood with nutrition and oxygen, and to make the blood flow easier, and all of this moving our metals and resources to different organs, but it also controls the metabolism of the nerve system. So how I am twisting this, we come back to the same thing. Because if the nerve system doesn't work, we doesn't have a lymphatic system. A lymphatic system is our immune system. It stores our antibodies and everything. And then we have the cardiovascular system that helps moving the resources around. So if the lungs is weak, then of course the metabolism nerve system doesn't work. And the nerve system needs extremely high amount of nutrition and oxygen to be able to create our billions of neurons. And just to give an example, in our brain have 86 billion different neurons. In the rest of the body, billions more. We have only 200 different cells, but these 200 different cells, when they create the fusion in the kidney and different areas in the body, it of course changes to another cell, but the mother cells is 200. So we need to, when we understand this neurological function and the importance of the nerve system, and this is probably the reason a lot of colleagues said to me, Michael, you're an idiot to start to learn this, because nobody can treat it, nobody can do anything about it. And I said, this is exactly the reason I want to learn all this. And this is what we do here in the academy. We have put together the medical knowledge, the neurological and biochemical in one education. We have one now for orthopedic that we call neuro-orthopedic practitioners, and then now in September we release what's called neurological and biochemical holistic, where we learn to work with autoimmune diseases. That is going to be totally game changer for the medical point of view, because here we put in the neurological, the biochemical, the root cause, how the body collaborates as a unit, and also emotional and psychology in the same medication, which I think should be mandatory in general medical school as well, for sure.
Michael, we've not even scratched the surface. It's been very fascinating what you're saying. We do intend to come back to you, if we may, in the near future and drill down a bit deeper into this. But I've got one final question for you. Do most people come because they have a pain or a condition that you can perhaps cure?
I never use the word cure. Cure for me is a black word. I normalize people, because normalize means for me, you're getting back to as you was when you were as good as you can be. Cure is for me a very negative word, and I never ever liked it. For me, is normalize and to make you happy again in sport. So we have so people come to us we have everything from chronic pain. We have people that wants to avoid a knee replacement surgery or hip replacement. We have people with fibromyalgia. We have a chronic fatigue syndrome. We have everything that comes here. They have tried everything that exists on the planet, and some of them are wealthy enough so they can fly all over the world to the best specialists. And then they come here and we help them and they get rid of the problem. And they get so shocked that they see this, what they say, how can this little sticker do all this for me? But it's probably one of the most advanced technology that we have today for helping people, even if it looks very simple. The good thing is it's medical class 1, it's FDA approved, it's approved by Minister of Health in the Middle East and many other countries as a professional device. You cannot buy it or get it if you not go to an educated therapist or doctor, because it's very advanced and you need to know how combine them with different other things. So we get all kind of patients that want to come here, and we even have small issues with ankle sprain kids that played football or whatever. And the nice thing with this is no chemicals and no supplements, and it's effect more or less immediately, and it's long-term effect. So we say that no matter what issue you have, it takes between 2 months can take 2 weeks to 6 months until you have a normal life again. And we have, of all thousands of patients I had here during the years, we don't have any relapse with the same problem. If they do, we are very strict with it. We can help you, but you need to do what we tell you to do. If you don't do that, don't waste my time and don't waste your money, because this is an investment you do in yourself, and to have the result that you want, you need to follow some guidelines. And here it's very simple. Stay away from sugar, stay away from alcohol, stay away from, if necessary, if you have an inflamed or colitis, stay away from gluten. Eat properly, eat meat, eat vegetable. You know, the old food thing you learned in school, you know, the food pyramid, follow that strictly. Fanatic is never ever good. We have many vegans and vegetarians, and their intestinal and immune system is really, really, really bad. So we actually teach them to eat meat again. But it's difference between meat and meat. Here we talk about good, high quality steak, not pig or not chicken. Once a week, I tell them, if they are really bad, just paint the steak green and write cucumber on it, and then you'll find. So it's very important, because people think that if you become fanatic to the right or left, I live longer or I stay away from diseases. But we need to understand first of all, humans is predators, and we need to understand the biochemical function. If we don't have, for example, red, medium rare steak once a week, our liver cannot produce glutathione that prevent us from free radicals and severe cell changes and other problems. And I think it's really interesting to give all this knowledge. I get a lot of people raising the eyebrow. Whoa, I never heard about that. And I said to them, or lymphatic system, what is this? They heard about it, but they don't know exactly what it's doing, which I think is important for the future, that people understand that the lymphatic system is the system that is healing us when we're sleeping, and it has 15 liters of liquid. And these 15 liters need to be renewed with 3 liters every night we sleep. So I say to all patients, the last urination you do before you go to bed, make sure it's clear. Then you're hydrated and you sleep better, your immune system works better, and you wake up fresh. It's very simple advice. So yeah, you are welcome anytime, Ronnie, and we can take any topic you want in different areas, and I'm always eager to teach as many I can about the knowledge we have here.
I can assure you, Michael, we're going to make you work very hard in the very near future. Thank you so much for today.
Thank you. Have a nice day.